Hopefully you are seeing my screen at this point. Yes. All right. Fantastic. So I'm first going to go into detail because I always like to know the history of things. So in the the profession, let's talk about the profession of case management. And it really has its roots in the late 19th century and really in the early 20th century with the development of modern social work and the growth of hospitals and healthcare systems. But it wasn't really until the 1970s and the 1980s when you had the increasing complexity of healthcare and the rise of managed care that case management really became a distinct profession that began to emerge and kind of evolve into its own. Now, what we're going to be going over there in the webinar is simply what you've seen on the screen. Now, I don't like to read slides, so that's there for your benefit, but I just want to talk a little bit more about case management and how it's emerged as a powerful innovation for better care for patients. Again, we're seeing a lot of complex health problems. We're seeing a lot of complex mental health needs. So, and that's due to a couple different reasons. You have the aging of the global population and a corresponding rise to chronic illnesses, and then patients with complex needs and clients, they often have multiple chronic conditions that go along with these mental health issues. And then that's somewhat compounds itself by the mental health comorbidities. And then you have social vulnerability. We are at a stage now, greater, I think, than any time in our previous history where social vulnerability is so prevalent, right? So prevalent. And so these patients or clients, they consume a disproportionately high volume of healthcare resources. And often what you see, and I'm kind of preaching to the choir here because you are all involved in case management, are these chronic illnesses and are sometimes poorly managed. And care coordination in certain areas is poor. And we're very fortunate here. We have a group in this webinar from all over the United States and over the world too, so that's great. But individuals or clients with these complex needs may really suffer preventable health deterioration. So preventable when their primary care or their mental health services are poorly coordinated. And they may be forced to use hospital and emergency services extensively. And that's why case management is such an important field. And not to say that it's often overlooked, but I don't think that it's pressed to the forefront like it should be. And I would love to hear your comments or your feedback on that because I feel like case management services are just so valuable. So I'd really like to get your feedback on that. I don't feel like, and again, this is me personally. So again, I love feedback. I don't feel like that it's always prioritized as often as it should be. So now we are going to go into the types of case management notes. I think we need to walk through those first. One is the initial assessments, and those assessments kind of document the client's needs, their strengths, their challenges. And then we have progress notes, which will document progress that you see in the client over time and summarize kind of those sessions or interactions. The name is very fitting. And then we have service notes, and those document the type or frequency of services provided to the client. And then we have follow-up notes, and those are simply follow-up actions that are sometimes taken after a session or intervention. And the crisis intervention notes, and these are more frequent than people would like at times, but these are to document responses to acute or emergency situations that arise. And then we have our clinical summaries, and those are kind of outcome evaluation notes that document the client's progress towards goals and effectiveness of interventions. And these are great for sending to reimbursement, state inquiries a lot of times, and notification of referral sources. So those are some of the type of case management notes that we see. So now one of the other areas that we're going to talk about is the different types of note formats. There are several formats that are utilized to write case management notes, and it's really up to the individual facility or the individual person or group to determine that exact format. So we have the SOAP note, the DAP note. We have the burp note. So, of all these notes here, what note type is your favorite? Or is there a particular note type that you are encouraged to use? And what we're going to do now is I'm going to have a little poll. And what do you feel like is the most common form of case management note type? So we're going to start polling that. What do you feel is the most common form of case management note types? And it was really interesting to pull this information, um, trying to look at multiple sources to see what was the common type. Kevin says soap note, great. Deborah says DAP, so fantastic. The goal, intervention, response, assessment, and plan. Very good, Carrie. Excellent. Sounds like we've got the DAP. DAP seems to be very, very common as well. Soap note. Very good. So I've got a lot of great responses coming in public and private. Fantastic. And I'm going to get back to that poll there. And it looks like, so interestingly enough, and I'm going to give you the results because when I do a poll, I like to share the results with folks. So 65% of you are saying the soap note, 15% of you are saying the burp, and 21% of you are saying the DAP is the most common case management note. And that's changing a little bit now. But it's in the upper 60 for soap, and you're absolutely right. It is the soap. It is the soap note is the most commonly used. It is the most commonly used. So that is the most commonly used note type is the soap. But more and more, I have to say, I'm seeing more organizations actually head to the DAP. So I'm seeing a lot of folks head there. But as you can see for our comments, like Pearl and Sheila, Regina, all of you, you have yes, soap note. So yes, soap note. And I have to tell you that I'm old school, so I learned a very long time ago. And soap note was the what we used was soaps. So always the soap. So all right, fantastic. But I really like the DAP too. I think the DAP is a little bit easier. And so, but that's great to hear your feedback. So thank you guys so much for sharing that. It's wonderful. Now, we talked about note types. We talked about the different formats of notes. And now I want to talk a little bit about the storage and security of ICANotes. So one of the things that is so important is keeping your notes secure. So storing any type of medical records really requires specific considerations. One, due to the sensitive nature of the information and the regulations that apply. And so the following are some common requirements for storing medical records. The security, we'll talk about security. You've got to protect them from unauthorized access, whether that's theft, damage, or destruction. And this requires usually use of some secure storage and access controls, passwords, and encryptions. And interestingly enough, one of the more common HIPAA violations is loss of a stolen device. So you may carry around a laptop or you may have a tablet where you store medical records in. You may be able to access them via even your phone. And as those things, it's really important to keep those encrypted. You must keep those encrypted because at any time, we don't think it's going to happen to us, but at any time, unfortunately, someone could steal your phone. You could be walking down the street and someone snatch it out of your hands. We've had that happen but before, and then someone could break into your home and steal your computer and your device. And those are things that we never want to think about happening, but unfortunately, they do happen. And not only now have you been stolen from, which is upsetting enough, but now the individual, if it's not encrypted, may have access to those medical records. So, and that may in fact be a HIPAA violation. And a lot of companies have had to face that. And one of the problems with HIPAA violations, and I don't want to say one of the problems, but one of the rules of HIPAA violations is if over 500 patient records are released, then you actually have to make a statement to the media about it. And that's why a lot of times you hear on the news, you'll hear them making a statement about this organization, there was a HIPAA breach there. It's a rule, it's a law. And so you don't ever want to be the reason that that occurs, right? So always making sure that they have some type of encryption on them, whether that's the biometric authentication, like a lot of phones have, whether that's a password, it has to be something that's encrypted. So now, as far as compliance, medical records must be stored in accordance with relevant laws, such as HIPAA, and only the individuals that are supposed to be accessing those records should have access to them. And then there's the preservation of records. And there are some different rules in that. It depends on what country you're in. It even depends on what state you're in. So medical records must be preserved for a required length of time, which can really vary by that jurisdiction. So, and you have to make sure that you prevent any kind of degradation or deterioration of those records. And records also have to be organized so that they're easy to access and they're easy to understand. And then all records should really be audited, right? They to make sure they're accurate and complete and up to date. So, and it's widely recognized in the healthcare sector that we are a prime target for ransomware attacks because we have all the sensitive information, and healthcare organizations often have limited resources to defend against these cyber attacks. And according to the Cybersecurity and Infrastructure Security Agency, the healthcare sector has had an increase in ransomware attacks in the recent years. And so when I read increase on that, I thought, well, how much is that? So digging down a little bit deeper, in 2020, they reported that the healthcare sector accounted for nearly 1/3 of all ransomware incidents reported to the agency. So a third of all the ransomware going on is in healthcare. I thought that would for sure be banking. No, it is in healthcare. And in addition, the number of ransomware attacks keep going up. They keep going up every year. So I'll give you some costs, staggering costs. In 2020, organizations in healthcare, ransomware cost about $416 million, right? $416 million. That's the cost of ransomware to an organization in 2020. But in 2021, it went up to $1.2 billion. So you're looking at an increase of about 188% over just 1 year. Just 1 year, that's how much ransomware went up. So it's really scary with our medical records right now, but there are some really good practices to keep them safe. One, you want to implement strong security measures. Again, encryptions, firewalls, access controls. And if you're like, look, I am not tech savvy, that's okay. There are certain things you can do, like VPNs, that will help you in installing different antivirus and malware things on your computer to help you. And sometimes bringing in a consultant is a not a bad waste of money, because it's going to cost you much less in the beginning than it will in the end if you have a hack. Also, just wanting to train employees on the importance of security and providing training on those best practices of protecting your health records, and just regularly updating your software. I know that that's something that's like we all get frustrated when we see the update on our computer as far as wanting to update that software, but it's really important to do that because a lot of times those updates will have those malware updates in them, and that will reduce your risk of vulnerability and getting exploited. So, also conducting risk assessments. So, risk assessments are really important. So, you just assess the security of the systems, you identify potential risk, and you take measures to address them. And another really nice thing is just limiting access to sensitive information. Like only people who provide access to healthcare records and who need it for their job, those are the ones that should have access to it. That's it. So, and always having a good backup and disaster recovery plan. And that may mean backing up health records. Now, if you have an EHR, EHRs do back up your health records. So, but if you don't have an EHR, that is something, or if you're not working, now let me say, not all EHRs are created equal. Okay. So some of them are certified. ICANotes is a certified EMR, but some EHRs that are not certified, they do not have to go by the guidelines of CMS, which means that they don't always have to go by the security guidelines. So that's something that and I have seen a lot of audits coming out recently from like state auditors and CARF and the Joint Commission that are asking people, because I'm having to send them all this information, basically saying what happens, like what is your backup plan at ICANotes, the EHR. And so it's really important that you know that you need to know what your backup plan for your EHR is, or for your again, you always need a backup plan, so make sure these individuals have one. And just be vigilant. Just look out for phishing scams, any kind of suspicious emails, or other threats. There are so many types of phishing scams right now. We did a HIPAA training with our company about a month ago, and there were like 11 different types of phishing scams where some are targeted, some are where they throw a wide net. They're doing it on your text messaging now. They'll send you a phishing scam on your text messaging. And this is all trying to get access to everything that you have, which could inadvertently be medical records of someone else. And so just don't click on links. I always say this, even when you're on Facebook or anywhere, if it seems too good to be true, if it looks like $15 Ray-Bans, it probably is too good to be true. Do not click on those links. Okay, do not. So if someone sends you an email and says, hey, look here, I had a CEO of the hospital the other day, his email was hacked. And he said, hey, I need you to look at this really quickly. It's very important, and sent me a link. And I just felt uneasy about it. So I called him. Sure enough, his email had been hacked and they had sent out links via that. So just always be on the lookout for this. And again, as long as you're following privacy regulations and you ensure that those health records are stored and they're being used in compliance with your privacy regulations and you're following HIPAA, then you're going to be okay. Now, since we have folks here from other countries, there is a general data protection regulation as well. So HIPAA, if you're thinking I'm in the United States and HIPAA is the bane of my existence, well, unfortunately, other countries have to deal with similar things as well. And one is the General Data Protection Regulation that governs most European nations. So hopefully that's some helpful information as far as storage and security of notes. I always think that's important to go through. So, all right. Hopefully that's helpful to you as well. Now let's talk about some of the benefits of case management notes. One is we are improving documentation, right? Case management notes provide a centralized, organized, and detailed documentation of the client's case history. Their progress is in there, their treatment is in there. Also, benefits of case management notes are there is better collaboration. So case management notes help different people in the organization or different people involved in that patient or client's care to stay informed and stay up to date with things that are going on with that client. And then you also have enhanced decision making. Um, I think that's really important because case management notes provide a really comprehensive view of the client's situation, and they enable informed decisions to be made regarding that client or patient. And then you have that improved continuality of care. So those case manager notes, they really provide a comprehensive record of the client's care, facilitating transitions between different providers or settings. That's key in case management notes. And then I I say enhanced outcomes, because case management notes are really enable of tracking the progress and monitoring treatment effectiveness, and that leads to improved outcomes for the client. And I'd really like to get your thoughts on this as far as some of the benefits of case management notes. You can put that right in the chat. So some of the things, one, if I missed anything on this list, please feel free to add that, but also to elaborate as well if you want. Because again, I really think case management is pivotal to the patient or client's success. And the case management does so much for the client. Now we're going to get into how to write effective case management notes. That's what you came for. So we're really going to get into that. And this kind of globe here really talks about the importance of the case manager note and writing them. One, you've got to identify the purpose of the note. Like, really, you're documenting the client's progress, you're summarizing a session, and you need to use clear, concise writing styles and avoid jargon and use plain language. Now, there's a couple of reasons for this. One, I'm not sure how many people are familiar, and I just want to say, if you've heard of information blocking in the Cures Act, if you can type yes in the chat. If it's no shame if you haven't, and you could type no in the chat. I just want to get a good idea of how many individuals have heard of information blocking or the Cures Act, because this rule is just as important as HIPAA. And what's happened is it came out about a year and a half ago. I'm getting a lot of no's, and that's okay. That's okay. I don't feel like that it's a federal mandate. It's a federal law. It and unfortunately, it came out about a year and a half ago, and it's called information blocking, and it's part of the Cures Act. Now, I'm going to break it down. Let's talk about HIPAA. You guys remember? Well, you're probably younger than me, but that's okay. HIPAA came out a long time ago, and HIPAA had a lot of great things in it, right? So there was again, what is I consider the bane of a lot of clinicians' existence is HIPAA, as far as getting releases and things like that. Um, but when HIPAA came out, it had a lot of good features in it. Like, it had the fact that you couldn't just lose your insurance, right? If you left your job. They had a lot of really good things in it, along with the unbundlement of the privacy and security. Okay. Well, the Cures Act is the same way. The Cures Act came out about a year and a half ago. And in the Cures Act, it has some wonderful things in it. It had a lot of money donated to cancer research. It had a lot of money and put aside and scheduled for brain mapping, for actually mapping the brain to figure out why people experience depression, what's going on with neurocognitive disorders like dementia. So, a lot of great things in that act. But one of the things in the Cures Act it was called information blocking. And what that means is you are not allowed to block information from your patients. And there are a couple things to that. One of the things that they consider is, like, we used to, or people for a long time, and I worked for a large hospital system that did this, but if you went to get your records, they would charge you for them, right? They would charge you for your records. You cannot do that anymore to your patients. You cannot charge them for records. That is against the law. If your patients or clients want access to their notes, then those have to be provided to them, unless they are psychotherapy notes, which we know case management notes are not psychotherapy notes, right? So that's one of the things. And so this basically, it made it where everybody should have access to their records and can have access to their records. And the only way that you cannot have access to your records is, again, if it's psychotherapy notes. And this is why, I don't know how many of you have had to pay an ER visit lately to a large hospital system, but a lot of times you're sitting in the ER and you will get your results to your test on the patient portal before the provider even comes back in to see you, right? And I don't know how many of you have been in that situation, but it is very much, EHRs will send out information. Now, ICANotes doesn't do that. And let me explain a little bit why. Because we're behavioral health electronic medical record. And the way that we kind of, I don't want to say we get around that because we do uphold the law to the letter, but we have patients request their records and then put it in the clinician's hands if they want to send the records or not. We put it in your hands because we don't know if that's a psychotherapy note or not. You have to make that judgment or call. There are also notes that could cause harm to the patient, and we let the clinicians make that decision instead of just pushing all the notes out to the portal. Which, if you've noticed, if you've been for healthcare services recently, a lot of places do that. They just push your note to the portal. They just push it to the portal, which is good because it's great. You've got your information, right? But at the same time, there could be situations where there are test results and things that you maybe you wanted to go over with your client ahead of time. Maybe your client really needed you to go over with them. And so we put that in the clinician's hands, but that is called information blocking. And one of the aspects of information blocking is they want you to avoid using medical jargon. So they want you to use that plain language. So when we're talking about that clear and concise writing skill, avoiding that jargon, it's really important that you just use plain language, which is really hard for folks. It's hard for folks that work in mental health, but it's really hard for folks that work in healthcare. So it really is because there are abbreviations that do not sound appropriate, like SOB, which is shortness of breath. Okay, so that's shortness of breath, or even just abbreviations such as FU, which is follow up. Okay, follow up. But there are things, so they want you to avoid using that type of jargon and acronyms and write those straight out. Okay. And so that's one of the things of case management notes, because now you're writing your notes and you have to assume that your client's going to see them. And so, and that really changes the perspective of notes, doesn't it? It really, really does. So, another thing about notes is focusing on facts, including keys, behaviors, thoughts, and emotions of the client. So, focusing on facts is really a good one. And using specific objective language and avoid assumptions and interpretations. Okay. You want to avoid assumptions and interpretations. So just specific objective language. Um, my previous, one of my previous jobs for a while was I was a expert for a very large law firm in the Southeast, and we represented large hospital systems and inpatient and outpatient settings with behavioral health. And throughout that, so meaning if someone was suing, if a client or patient was suing, then this law firm would get involved on behalf of the hospitals. And it's kind of horrifying sometimes to read some individuals' notes. You, your cases, your liability cases, truly hinge on the fact of what you documented. And sometimes I knew when I was reading those notes that people probably did not ever intend to say that. Sometimes when I was reading notes, I knew right away that there was not objective note taking going on, that people were making assumptions and interpretations. And some notes were just flat out judgmental, you could tell. And that would really, really hurt the clinicians and the hospital system and the law firm when we went, because when they will actually take your notes and read them out loud in a court of law. And that's so scary to think about. It's very, very scary to think about, but it's very important that you think about that when you're writing your notes. Just, and this is what I love. This is, I'm going to tell you things, the key that saved people all the time. Because I have to brag that we had a really good winning streak. So while I worked for them, it was we did really well. But here's the thing: verbatim statements. If the client says it, there's no arguing with it. Verbatim statements are one of the key things that will help you in a liability situation. I don't want to say get you out of it, but will extremely extremely help you in a liability situation. And right now, a lot of people, unfortunately, the climate is a lot of people are practicing defensive medicine, I call it, right? defensive medicine, because we're ultimately writing our notes so we can, one, go back and see it, we can share with the healthcare team, but also to avoid a lawsuit, right? That's a lot of the documentation is done for that. And whether that's good, bad, or ugly, that's one thing that we just have to admit. And so, verbatim statements, if the client says it, that's not your assumption. So, those are the best statements to put in the note. Client states or patient states this, you know. I know that my my treatment plan says to do this, but I don't want to do it. I mean, verbatim statements really give you a clear picture of what's going on with that client more than any other kind of documentation. Now, I do encourage you when you use your documentation not to be overly wordy and be concise, but also um, use specific objective language. So just focus on the facts, just the facts, right? Um, Put it in plain language, focus on the facts, include key behaviors and thoughts of the emotions. Again, verbatim statements. All right. And one, you want to document the interventions, the strategies, and the follow up actions taken so you can maintain that client confidentiality. You've got it right there. And put any relevant details in date, time, location. Date, time, location. So I see a lot of people make mistakes in notes and they'll say, well, last week the client did this. And no, last Wednesday morning, the client did this. So, and use a consistent and standardized format. So I think that's a really important thing. And also you want to review and edit your notes regularly because you want to make sure they're accurate. You want to make sure that they're complete. Um, a half written note is a bad note, right? So, had the best intentions, but just didn't get there. And also, it's important to get feedback, just to regularly share and discuss case notes with your colleagues, with relevant colleagues, okay, that will give you good feedback. And if you have supervisors that are supportive, that's a good area. Someone who's been doing this for a while, especially if you're new. I know we got some private messages about you're new into case management. Really, this is a good time to kind of lean on your colleagues and get some information from them and documentation tips from them as well. So, and I hope that some of those things have been helpful. I want to talk a little bit more about some guidelines about creating notes. And when you're documenting behavioral observations in the medical record, it's really important, again, to be objective and precise and very, very professional. So avoid using, subjective language or making personal judgments about the patient or client. Just describe what you observed in a neutral, objective manner. Be really precise about the behavior that you observe. We talked about time frame. Again, use standard tech terminology. Abbreviations, not I would not encourage those anymore because of information blocking. And just make sure that your document is clear and consistent. All right. And you can check with others on that to say, hey, this is what I meant to convey in the note. Is this what it says to you? If it's somebody that's your senior and has been doing it for a long time, you can also say, how would you write that? Right. Now, they may not always give you the best advice, right? Because we're all human. But it's good to get feedback. It's good. And make sure you go to someone that has your best interest in mind. And then you also want to think about it from the patient's perspective. When we're documenting behavioral observations, consider what their perspective is and document any relevant information about their perspective or experience. So, how are they feeling? Again, verbatim statements are wonderful for that. Patient states, he's had a crappy day. So, John states, I have had a crappy day. I don't feel good today, but I know to use my coping skills. Great. That one sentence gives you a clear picture of what's going on with the patient. And another thing in notes that you want to keep it brief because it's important for you to be descriptive and it's important for you to be specific, but you've got to keep your documentation very concise and focused on key behavioral observations. All right. And again, I cannot stress reviewing and revising. Sometimes you're tired, you're writing notes. I know a lot of you and I don't want to make assumptions, right? I'm telling you not to make assumptions, so I don't want to make assumptions. How many of you write your notes later in the evening? And if you don't write your notes later in the evening, tell me what time of day is good for you to write your notes? What's your favorite time of day to write your notes? And sometimes evening is not your favorite time of day. It just happens to be the time that you write it, right? So what are some of those time periods that you write your notes in? I'm getting some people, yep, midnight hours. Midnight hours for some people. I've got evening, early morning. Good, Deborah, good for you. Early morning is great. Early morning is great. I've got a lot of people with evenings, some people in the morning. That's great. I need some caffeine before I get started in the morning. I do. But evening, Kevin, good for you. You said as soon as possible. That's great. That is great. Gina, right. Sometimes after I meet with the client, that's the best time, right? Immediately after you finish. Because when you're in a couple clients in, it's difficult to remember, right? It's difficult to remember. So if you can do it right then, great. I know your schedules don't always allow for that, though. I know you're busy. So next morning, yeah, Brenda, I think Brenda said it perfectly. I try to write it right after seeing my client, but it doesn't always work out that way. Exactly. You're busy folks. You're busy folks. And so, yep. Coffee's non-negotiable. I love that. I love that. All right. Well, good, good. Thank you guys for the feedback. That's great. That is great. Um, so good, good. Yep, keep it coming. Exactly. And one of the things I wanted to talk about is when we're talking about, we talked about thoughts and feelings and perceptions. Interventions are great to put into the note and the plans for the patient. You always want to have where you're going and what you're doing with this particular client. Now, next, I'm going to take you into our software system and I know not everybody here is using the software system, which is absolutely fine. But I think it gives you a really good guideline. So this might be an area that you want to take notes. And I can also send you, we have some handouts up as well, but I can send you the way that our notes are laid out and kind of information that you would want to put in those. All right. So let me switch out screens real quick. All right. Hopefully you are able to see my screen. I'll give it just a second. A lot of you do it. As I'm looking through these comments, a lot of great comments. A lot of you do these notes right away, and kudos to you for doing that. Absolutely, because that's when it's fresh on your mind, right? It's fresh on your mind. So fantastic. Well, this is ICANotes, and this is kind of a little bit about our system. I do want you, as I'm going through this, if you have questions for notes, I want you to please put them into the chat now because I want to go ahead and make sure I am able to get those. I am going to answer some right now. Before Deborah says, my records are on a platform. I do not keep any other records. Just seems to be the safest method. What do you think? I do think your records are safer on an EHR platform. Or even if you're not using an EHR, if they're on a computer system and you have backup files for that, the times that I worry about notes, and I don't know if you guys see this, but um, I sometimes, occasionally, I will see like around here we had a storage facility and it had a fire, and I was really concerned because I thought, gosh, these people, they lost probably family heirlooms, and I felt horrible for them, and sure enough, someone I know was like, oh my God, all my patient records were stored there. And so they had lost, and they had been in practice for a long time, all of their patient records, all of them. Now, what happens? What happens when that patient comes back to you and wants her records? Because they can request them, right? So this is, yeah. That's difficult. That's difficult. So, a lot of time I've heard of people kept their records down in their basement of the home, which is secure, but then their basement got flooded. Okay. So there's a lot of things there. So one of the questions I had, Julia said, what is SOB? Shortness of breath. Okay. Not what everybody's thinking when I say that, but shortness of breath is actually, and it looks bad on a medical record because if you say patient is SOB, they don't know what SOB means. That's why we try to avoid, now that the patients are able to see all of their records, you can't charge any fees for them. Really got to be careful about the documentation that we use, right? So, all right. Sheila says, how long are we supposed to save client records? That's a really good question. So I'll tell you just the standards for some states, the standard is 7 years. So it really is dependent on the state that you're in. A lot of states are 7 years, but there are a few states that went to the 10-year policy. And so depending on what your state says, you have to abide by your state in the US. So now also with if you're serving pediatric populations, that's a whole nother can of worms, right? Because they can have access to their records years after they turn of age. So now you are protected by your state policy. So as long as you're doing what your state says, then you should be fine. And you can usually Google the health and human services of your state and they will have their policies and guidelines just outlined there for you. So, but you don't have to go above and beyond, but you do have to match what your state says. So make sure you're abiding within your state. I know that one of my friends was in a practice here in North Carolina for a period of time and then moved to another state and didn't realize that that state had stricter laws about saving documentation. So that could be problematic. Let's see. Brenda says, if you're in private practice and not accepting insurance, do you still need to keep notes and treatment plans? That's a really good question because let's talk about it realistically, right? Um, you because if you are billing insurance and you're getting reimbursement from payer sources, whether that be the state or Blue Cross Blue Shield or whoever it is, you have your documentation has to be rigorous in the point that you need to get your reimbursement from those folks. Now, if you're in private practice, you're getting reimbursement directly from the patients, right? Here's the problem. If that patient comes back and they try to sue you, which again, folks, this is, if you look, and I don't have the data now, we do have a great webinar that we do usually once a year on behavioral health liabilities. And we do that with a woman who's fantastic. Her name's Cheryl Gregory. She is an attorney and a nurse and specializes in behavioral health. And we go through the statistical data on that. And every year, people are getting sued more. It's not less, it's more. And it used to be that mental health, you because like honestly, if you like I'll take for example, if you are a primary care provider, there 1 in 3 of them will get sued within the next 5 years. 1 in 3. Okay. That's primary care. You're right. You're like, well, mental health's different. No, what we're seeing, it's wonderful. The stigma for mental health has gone away in the past couple years. We still have a lot of work to do on it, but now people are feeling a little bit more comfortable with that and they lawsuits have increased in mental health, right, which affects everybody. It doesn't matter if you're a psychiatrist, a nurse practitioner, if you are a case manager, if you are a therapist. Okay, so yes, this is something that you do. I would keep notes and treatment plans. So I would absolutely keep notes and treatment plans. So because if they come back, here's the thing, a lot of times in lawsuits, and it would be really traumatizing to individuals, and they would be very upset, and they would be talking to our legal team, and they would say to us, "I don't even remember this patient or client," and they would have a lot of guilt off of that. But the difference is that you see a ton of people, right? You see a lot of people. You cannot possibly remember everyone. There's no way that you're going to be able to do that. So you only have your documentation. And the sad thing is people don't come and sue you like the next month later. That's not how that happens. They generally will do that like within a year. It's a year period of time, but a lot can happen in a year, right? So Carrie says, "Do you need to include a diagnosis in the case management note for insurance reimbursement like you would telehealth?" Generally, yes. For insurance to reimburse you, you're gonna have to have an ICD-10 code, right? So you will. Absolutely. Great questions. You guys have some really, really amazing questions. Excellent. All right. So I'm going to pop into the case management note and I'm going to show you what the best thing for documentation is. So when we go in, one of the case management notes, the presenting problem is always a really good area to start. Like if they're having depression, if they're suicidal or self-injurious, if there's substance use going on, if they're dealing with children and there is conduct disorder or oppositional defiant disorder going on, you can definitely indicate that in your note. And again, this is where I would talk about symptoms. Like if they're depressed, I would say, they're hopeless and they have feelings of worthlessness and they have increased substance use going on. If you're dealing with adults, then this says this is a 14-year-old, but it's not, it's an adult. There could be libido decrease or sleep difficulty. So, and then this is right when I would pop in my verbatim statement. Piper says she feels like, and I would just type that right out. Okay, that's my verbatim statement right in there because Piper is saying how she feels. Right? You can describe the symptoms all day, but it is Piper's words. Now you can go into social support changes. If there have been social support changes, I could say there have been none right now. We can talk about family input if you've received that, or provider input. Maybe we haven't gotten any of that. Um, if they're on involuntary status and you're seeing them in case management, then you would want to put in that legal status, make sure that's in the note. And then services provided today. So I could go in and say, today we completed an application and maybe it was for housing or financial assistance. Okay, we completed that. So you can put those things in. Maybe we called and set up an appointment with a psychiatrist. Maybe we help them meet with their probation officer. Whatever it is that you're doing in case management, I'm interested to see when you're providing services in case management, who is the person that you contact the most? Just so as a generalized, are you working with the healthcare teams? Are you trying to get them housing, financial assistance? Who is it that you're working with? So, and then the next I would talk about, kind of what's their appearance, right? How are they looking today? Maybe they're calm today and they're talking with you and they're relaxed, okay? Hopefully they're having a good day. And then I would talk about maybe their behavior in the session, that there's a depressed mood there, if if they've been appropriate during the session, what's going on. And maybe they're crying in the session, right? So, and there's some negative self-talk and some suicidal ideation. And then about their verbal content, what are they talking about right now? Like if it's a child, are they having issues in school? Are they having issues with relationships? Right? Are they having some feelings of maybe they broke up with the boyfriend or girlfriend? So we've got some loss going on there and they're angry about it. What's happening in this patient's life? And then, so a lot of verbal content, okay? That's what want to put exactly, and again, verbatim statements in these. And then the interventions, like what are you going to do? So how are you helping them? Now, if you don't have a treatment plan, and most of you are going to have a treatment plan, you can pull in things like we're offering coping skills and I'm supporting them and I'm encouraging them to vent. And ICANotes will kind of come up with these clear, concise statements that aren't too wordy, but are specific in nature, right? And so about what you're doing. Now, one thing I would definitely cover is if you have treatment plans, I would link in that treatment plan. So you can go in ICANotes, I can grab the treatment plan, I can click on depressed mood, and there all my short-term goals and interventions will come up here. And so I will grab one of those. So I can go in and select that. I will grab my short-term intervention here. We want Piper to get back to her activities, so I can link in that intervention. And I can put in my target dates, completion dates, things like that. So I can put in where activities can be attended. Maybe she has cheerleading, twice a week. She can't go, so we put that in there. Okay. And then what reimbursement companies want to know is what kind of progress are they doing and what are you going to do with that plan? Now, if Piper's doing pretty good with her progress, I want to say, she's doing pretty good. If she's not, I can say, there's been no apparent progress and we need more time on that treatment plan, or we need new short-term goals because we have fantastic goals for her, but she's just unwilling to do them. Okay. And that happens, right? Sometimes you have the best goals for your client and they're just not going to do them. So, whatever you need to do there, but this is what reimbursement companies really want. And then the last thing, if you are using rating scales, some of you may use rating scales. We have them all in here for you. So let's say with PHQ-A for adolescents, I could go in and say, she's got a number 13 on that. So she's got moderate depression going on. And then one of the things that I would always encourage you to talk about is their suicide risk and violence risk. And so I could say, as far as their suicide risk, I could go in here and say that she is not suicidal. All right. And maybe her denial is convincing. Okay. So those are things that I would definitely put in the note. As you can see, the diagnosis is here. And that's one of the really great, again, if you're billing insurance, you definitely need this ICD-10 diagnosis. And then I simply save as a progress note. And I have, as it's compiling, I have a fantastic note that I have written here. So that just goes through everything. So it looks like I've been writing on this all day, right? It really looks like I've slaved hours on this. But as you can see, it took me about 5 minutes to go through it. So it literally takes you about a minute to complete your notes within ICANotes. For case management notes, a minute to 2 minutes once you've got the system down on completing your case management notes. So again, verbatim statements, got to put those in there. Deborah says, do you have a training on treatment plan? Yes, I love treatment plans. Treatment plans are one of my favorite things in the world. I know that they are the bane of other people's existence and other people hate writing them. I just love writing them. And I write all the treatment plans in ICANotes. So I love it. So yeah, we'd be happy to have one of those. We can absolutely do that. So absolutely, absolutely. Well, listen, I if you have any other questions, please don't hesitate to ask us. You will get a video of this today. We have some handouts up at the top, so please grab some of those because we covered a lot of information here today. So there are handouts to help you up there. So I believe we even have slide handouts. I'm not. But we do have sample case management note up there. And I believe we also have like a checklist for you that was created by Sandy Crawley. It's absolutely wonderful. So thank you guys. Thank you all today for joining us. Your participation really is what made this a really valuable experience for everyone involved. Love hearing from folks. And so we appreciate your time. And I hope you've gained some insights today and had some from our discussion some knowledge, and we look forward to staying connected and providing more opportunities for learning and growth in the future. So again, thank you so much for joining us. All right, y'all have a wonderful day.